Welcome to our first newsletter for the Queensland Centre of Excellence in Autism and Intellectual Disability Health, or QCEIDAH for short. Here is a photo of most of our team at a recent event. So I'm here with Kathy Franklin, who is going to tell us about QCEIDAH. So who is QCEIDAH and what happened to the MARDAs and the QCEIDAH?
Good question, Katrin. The Queensland Centre of Excellence in Autism and Intellectual Disability Health, QCEIDAH, is the new name for our team. It's a long name, so we call it the Queensland Centre for short. The Queensland Centre includes what you might remember as MIDAS and QCEIDAH wrapped up into one, plus our newest addition, the Queensland Centre of Excellence in Intellectual Disability and Developmental Disability Mental Health. But more on that later. We have the same aim to improve the health and well-being of people with intellectual disability and those on the autism spectrum.
So what does the Queensland Centre do?
What do we do? Well, the Queensland Centre provides a clinical outpatient service, education and research.
So where is the Queensland Centre?
The Queensland Centre is located at MARDA Hospital in South Brisbane. We're across the road from the MARDA bus station and a short walk from the South Bank railway station. Our clinic is in the Salmon Building on Stanley Street and it's on level 4. It's the same location as the MARDA Children's Outpatient Clinic used to be if you came to the MARDA Children's Outpatients when you were little.
Yes, I was. So for people visiting our clinic, we made the video just to show where we are and what to expect when you do visit us. You can find it by searching how to get to the QCEIDAH clinic on YouTube, and we'll link it in the description. So who works at the Queensland Centre?
Well, our staff includes a lot of people now. Psychiatrists, a general practitioner, a visiting rehabilitation medicine physician, nurses, psychologists, an occupational therapist, a speech pathologist, a social worker, and a team of research staff, including research assistants and research assistants with lived experience. And we also have a manager and administrative staff. So
where does the funding come from?
That's a good question. Where does the money come from? The Queensland Centre has funding from Queensland Health and from several research grants, and most of that funding is from Australian government research grants. We're also supported by the MARDA Foundation.
So Kathy is now going to tell us about the Queensland Centre of Excellence that she has mentioned before but left us hanging.
Well, we recently launched a new part of our service called the Queensland Centre of Excellence in Intellectual and Developmental Disability Mental Health. This Centre of Excellence has the job, and it's a big job, to support the people who work in health and mental health care to be better at working with people with intellectual and developmental disability.
So what does that mean in real life?
Well, in real life, one of the main jobs for the centre is to work with the intellectual and developmental disability mental health teams in the mental health services to provide education for their staff, and also to support their staff in clinical areas, helping them figure out what's happening with the patients that they're seeing.
So you can see some of the launch presentation by the director of QCEIDAH herself, Dr. Kathy Franklin. But Kathy, can you tell us what this change in funding means for the clinic?
It means good things for our clinic. We've recently updated our referral criteria, and with the extra funding, we can see more people at our outpatient clinic and by telehealth. So to access our service, people will need a referral from their local doctor. You can find out more on the MARDA website, and we'll put a link to it in the description.
And now we have Kitty Foley to tell us about the National Centre of Excellence in Intellectual Disability Health.
Hi, I'm Dr. Kitty Rose Foley. I'm a Senior Research Fellow at the Queensland Centre of Excellence in Autism and Intellectual Disability Health.
So Kitty, what is the National Centre?
The National Centre of Excellence in Intellectual Disability Health was set up to make sure people with intellectual disability get better health care. Notice that it focuses on intellectual disability and not autism.
And what will the National Centre do?
The National Centre will be a leader in intellectual disability health. It will have new ideas and work together with other services and organisations. The National Centre will help health services do a better job of meeting the healthcare needs of people with intellectual disability.
So who provides the National Centre?
So the National Centre is provided by a group of 9 organisations. The University of New South Wales in Sydney leads the group of 9.
So what does the Queensland Centre have to do with the National Centre?
The Queensland Centre is one of these 9 organisations. We are leading one of the 4 teams called the Health Services Development Team.
So what does the Health Service Development Team do?
The Health Services Development Team's job is to focus on helping healthcare services do a better job. It will be set up as a network for health professionals and will research the best ways to deliver healthcare for people with intellectual disability.
So who are the Queensland Centre staff who work on the National Centre?
My name is Dr. Kitty Rose Foley and I'm a Senior Research Fellow at the Queensland Centre, and it's my job to lead the Health Services Development Team for the National Centre. I'm working with Amy Gisbert, who is a research assistant who also works on the National Centre. I also work with Ruby. Dr. Catherine Franklin and Dr. Katie Brooker also help to oversee this work.
And so now we have a research update from Katie Brooker. So our Bridge to Better Health project is open for recruitment. So Katie, what is a Bridge to Better Health project?
The Bridge to Better Health project wants to improve healthcare and general practice for people with intellectual disability. So we're partnering with general practices across South East Queensland to provide training, education and support to practice nurses when they're doing annual health assessments with people with intellectual disability.
And where can people find out more about this project?
If people want to find out more, they can check out the Bridge to Better Health website that'll be linked down below.
So there are some training opportunities that's coming up in the future. The National Centre is looking for PhD students. So if you're passionate about improving health outcomes for people with intellectual disability and are looking to develop your current design research skills, this opportunity might be right for you. So check the description for links for more information. So Deaf Connect have a variety of autism courses for families and services available on their website. The only important dates to note for this newsletter is our Christmas closure, and will be closed from December 24th of this year, 2024, and will be reopening next year on January the 6th of 2025. So make sure you're signed up to our newsletter by using the link in the description. Thank you for listening to our first ever newsletter, and thank you to all people that I have interviewed. And that is a wrap. See you next year. Cut!